I'm Dr. Rick Greene from the 1970 class at the University of Virginia School of Medicine, and it's my great pleasure to moderate this series honoring our emeritus professors, emeritus faculty at the university. And it's especially a pleasure for me to talk today with Dr. Deering Johns, who not only has been president of the Medical Association, but in 2013 was given the Outstanding Alumnus Award. So Deering, thank you for being here.
Thank you, Rick. It's a pleasure and an honor.
So what I'd like to talk about first is how you got here. How did you get to the University of Virginia? And obviously we'll go from there.
Well, that really for me begins with college. I went to Sweetbriar, majored in physics. The first job I had was at the Rockefeller Institute in New York in the lab of Paul Weiss, the fellow who tied a ligature around a long nerve axon and discovered thereby axonal flow. It took a long time before the world sort of believed and other proofs were developed, but that began my interest from physics to sort of biophysics. And after a year, I decided to come back to Charlottesville, close to home, for me, Lynchburg, and College Sweetbriar, to go to graduate school, which I did in physics, but then began working in research labs, and ultimately in a neuroscience lab. And that was my first real introduction or change from basic science study and efforts to accumulate new knowledge sort of mainly to a focus on man and disease. And that's really what prompted my desire to go to medical school. And I already was in the seat of wonderful knowledge here in Charlottesville and the university, so it was a natural for me to decide to come here. It took a while. I had to go back and take courses in biology and chemistry, and by that time I was 10 years ahead or behind my chronological peers, older than my chronological peers who were entering medical school. But that's how I got to the University of Virginia School of Medicine at a time when they had a 3-year program, which was particularly appealing, being older than most of the students. So there were 30 of us, and there was supposed to be a 30 in the larger class who were the control group, and a wonderful faculty who focused mainly on us. And we had, for instance, anatomy over one summer with no other competing courses. It was terrific. The same with pathology. And then the other medical school courses came in stride. But there we got introduction to patients in our first year, our second year, long before, at a time before our current medical school teaching does so, introduces us. So it was a wonderfully exciting and fun time and a terrific place to be.
Well, I have to ask you, why physics as an undergraduate?
Well, I wish I could be more, I could give you a more noble answer, but I chose physics. Well, this is noble. I had an inspirational teacher. She was the wife of a biology faculty member here and commuted to Sweetbriar. But you only had to take 1 or 2 classes a year to get the major and the hours. And then you had time to take art and language and other things that were also fascinating. So it really, I guess, was the inspirational teacher, for I never would have kept at it without her. But it was also the ability to think about other things as well.
Right. Well, it brings up the whole concept of mentors. You've been a wonderful mentor over the years for people. You eventually gravitated to internal medicine, cardiology. Why that area? Not surgery, for instance.
Right. So that evolved, and I would say the first step was after my internship, and I had a hard time choosing between a surgical or a medical internship, but I chose medical thinking perhaps it would be broader, and went to George Washington University. During the middle of that year, I decided I wanted to come back to Charlottesville, so I wrote Ed Hook, then chair, and told him I'd like to finish training in his program. I got a letter back from George Craddock, who I think was head of training at the time, who said, "We don't really have space for you, but we'll circulate your CV." A little while after that, I got a call from Carlos Ayers, who said, "We are just beginning a hypertension fellowship, and I wonder if you have any interest." So that was really the beginning of a whirlwind of just great learning and doing for me. I came, and Carl Ayers was the PI. The other sort of clinical mentor was Bob Carey. The basic science mentor, Mike Peach. What more wonderful group could you have? Also, Ed Miller and Derricat Vaughn, and I'm blocking on the name of Michael John's younger brother, but he that was here at the time doing research, all related to hypertension. And so it was just a dynamic, fascinating group, on the outside of which were these wonderful cardiologists, Lockhart McQuire and the department chair before George Beller.
Right. It's too many people even to mention sometimes that were surrounding you.
Well, they were just wonderful clinicians. Yeah. And so that sort of sparked it was the people who sparked my interest in cardiology, coupled with an interest in physics and hemodynamics, and that all sort of fit. But I have to say, for me, it was really the inspirational mentors and teachers.
Right. Was there any time when you were wooed away from Charlottesville, or you might have left Charlottesville to do something that you couldn't do here?
I would love to answer that, but first I just have to say it was Julian Beckwith who was the
Julian,
other person
of course.
I didn't remember for the
Absolutely.
moment. But yes, I thought very hard about going to the University of Pittsburgh to head up a hypertension program there, and nearly did it, but my roots were deep here, so decided ultimately to stay.
You've been such a supporter of the alumni activities here. Not everybody supports alumni. Not every person who graduates has that feeling. What is it about alumni activities that caught you, that has that spark? And how do we give that spark to others?
I really think it's the friendships that you make, the colleagues that you get to know. They are wonderful. They have great senses of humor. They are bright. They like to talk about interesting things. So that's what caught me. And I think what we are doing now, which is getting alumni back in small and large groups, but small groups make all the difference in the world, I think. So you really have time to chat and get to know each other. I think that's really the best way to keep the alumni group blossoming. And there are so many out there who I think would really love to be a part, but don't recognize the value that they get from it. That might not be a fair way of saying it, but don't recognize that it's as much as interesting and rewarding to come back and learn about the school as it is to have that as a part of your past that you're proud of or pleased to have been part of.
Tell me a little about, other than alumni and maybe some of the medical things, what are you doing outside that really excites you? What are your interests?
Outside of medicine?
Right.
Well, all through I've loved to read, and for me that means fiction as well as nonfiction, and I love to travel. And I was sort of expecting to hear you say what's going to happen to the rest of my life and career.
Well, that may be coming next.
Oh, well, let me anticipate it quickly and tell you that it's still in evolution. But I am still teaching the first and second year medical students, which, that probably, besides colleagues in an academic setting, it's the medical students who, for me, just made it a wonderful career, because they are interesting themselves, they are fun to be with. It is so rewarding to see what they do with their lives and to know that you had a small part. in their choosing the steps that they chose. And so that's why it's particularly nice for me to be able to keep a finger in now that I've retired from patient care.
Well, let me ask you about being a woman in medicine, because more than half of our classes now, generally in medical schools, are women. Obviously, you've mentored many students. What do you tell a young woman as far as a career path in medicine today? Are there any type of career paths that you feel are important? You know, and the whole concept of having families, of doing what we need to do outside of medicine.
Well, I think that's a very important question and a difficult one. I think that there are some specialties or areas of medicine that seem like they don't fit as well with being a woman if you want to have a family. But what I really think is any woman, and really any graduate of a medical school who wants to go into academic medicine, should find something that really fascinates them, and so much so that they can become the expert. And I think in academia you still need research as some part of your life, so that you'd be interested in doing research in that area, but as you become the expert, your choices for your time become more your own. So while on the surface a surgical career might seem more difficult to order or schedule your own time, I think once you get beyond the training years and get 2 to 3, 4 years into the faculty life, it becomes much easier. And I think that's true of all specialties, really. I think focus is the easiest way to control your life, and I don't think life is always controllable no matter what you do, but that gives you the most choice over how you spend your days and nights.
What do you think of the work hour restrictions that our trainees have to follow these days?
I have such mixed feelings. I remember too many sleepless nights. I don't remember mornings or nights when I couldn't function or think. I think there's a great deal to be said for staying very close to patients and their diseases early in your career, and by very close I mean on a daily basis pretty much, especially acute illness, to really learn the natural history. And if the work hours are too constricted and the nights on call, many things happen at night that you never see in the day, I think it shortchanges you. I don't have the answer to how to do it. In my opinion, most every time we put in a regulation and pay strict attention to it, that's when troubles begin. If we could just be sensible about allowing, perhaps having overall regulation or hours limited, but an occasional breach of that. For I think the other place that training is hindered with these resident hours is in their academic training. They can't go to grand rounds and lectures and other things because they still have some service load to do, and when they finally finish that, they're already at the top of their hours.
Are you a fan of the electronic medical record?
I'm not. I think I am a fan. It was a little hard to learn, but the best course I ever took in high school was typing. So for me, getting through that part wasn't so difficult. It is, I think it has some real drawbacks in requiring you to say that you have touched every base, and I think that often makes the medical record overburdened and more difficult to find the stream of important things going on. But by and large, I think it's a good tool to have and will become a good tool for sharing. I guess I look at it from afar the way they do in Europe. And I think they have such a wonderful gold mine of information for research on patients that I think we could become that too if we can get over our fear of confidentiality, I guess. And if we doctors can learn how to treat confidences correctly. We don't always.
Well, I think as a physics major, you could master anything. It's been a real pleasure today to talk to Dr. Deering-Johns, who not only is a wonderful clinician, researcher, but a wonderful alumni member of the University of Virginia. Deering, thank you so much.
Thank you, Rick.